How you all doing, comrades? My name is Comrade Rowley. Welcome to Clacker ULC Brisbane. So I wanted to talk to you. So I'm currently in Queensland in relation to my mum has died, and so I managed to get crisis accommodation in a motel, and I've also managed to tell, and I've also managed to get crisis accommodation. While it's not quite affordable, I managed to get that. But today I wanted to talk to you about transgender healthcare. So I've had difficulty finding bulk billing GPs who specialise in transgender healthcare in Queensland. Um, Most of them are now private practice. I managed to find one. Well, I managed to find one GP, but it's up to basically it will be up to the doctor's discretion whether they decide to bulk bill me or not. As we know, there is a ban on Tim Nichols has banned transgender hormones for transgender youth under 18. 18. So I wanted to, and I happened to be due for my testosterone shot injection um, on Tuesday, and I wanted to. And so I thought, well, I'm going to take the plunge and see how difficult it is to be able to access. I've already gone through the process of being on testosterone. I've been on testosterone under the informed consent model since about April 2019. And so, and the part that was always a concern in the back of my mind is being able to access gender hormones, since the ban on transgender hormones. So I found out through an organisation called Open Door that caters for transgender youth under 25. One thing that they are lacking very much is um, access to bulk billing transgender GPs in Queensland. That is the biggest thing that I've come Across, so I have got an appointment with one bulk billing GP on Tuesday this coming that I managed to get through Trans Hub. I wound up going through Trans Hub to find them. I found three, and basically they say it's up to the doctor's discretion. Now, my GP in New South Wales, he left, but my medical centre that I was going through in New South Wales, where I normally get it's normally done by the nurse on site at the GP's office, where I get my hormones injected by depot injection. So the good news is I'm pleased to report the ban on transgender hormones. It only applies. Well, it's not good news. News like there shouldn't be a ban. Period. But the ban on transgender hormones for and puberty blockers that applies to transgender youth if you are under the age of 18. 18. Um, if you're over the age of 18, yes, you can access hormones and so as a precautionary tale, I just in case, I got my New South Wales GP to email me my testosterone script. And so it's just a matter of me finding a nurse who will give it to me. And I found two Two, in the event that I can't get a transgender GP in Queensland, I found two nurses that will do it. Do it. The good news is that in Queensland, yes, you can get your hormones in Queensland. In Queensland, essentially, the the chemist asks you for the chemist normally asks you for identification. So I just had to show my 18 plus card that I'm over the age 18. um, which feels a little bit like yeah, it feels a little bit like they're treating it as though um, they're treating it like alcohol. Basically, that's what it feels like. It feels a little bit like they're treating testosterone like it's alcohol. Oh, well, you've got to be over 18 to get it, or cigarette smoking. When testosterone is not actually it's not actually bad for you. Like it's actually like a good thing, a thing for it. So yes, you can get testosterone in Queensland, Queensland that has been prescribed to your doctor for us transgender people, but you have to show photo identification. Action. Um, Testosterone is not alcohol, and so they will. So if you walk into a chemist, they will fill your prescription for testosterone, and it feels a little bit like it feels a little bit like you're treated as though you're going in there to get alcohol. That's basically what it feels like, where you've got to show your phone. Yeah, that's basically what it feels like. So hormones, they're not illegal as such, but it's basically you must be over 18. You must be over 18 in order to get and make sure you. And it was really weird. I kept waiting for the gender police to tap me on my shoulder in getting it. So I found a couple of nurses in the event that I can't see this GP on Tuesday. I found a couple of nurses that will do it. I had to basically show them my old testosterone informed consent agreement from Dr. Rachel Burden, in order to show them that I've been on this, I've had no side effects, etc., etc. It's in fact saved my life. It saved my life in terms of not being rushed to hospital for heart attacks all the time, and other associated health problems that I suffered from for years. 4 years without this. Um, hormones really do save transgender lives, and I think the ban, it's stupid, it's transphobic, and they're not taking into account that um, and it's like being a diabetic, and especially for transgender men who have had a hysterectomy, we have to take this. We we have to take this, otherwise it will result in death. So transgender hormones do save lives, and do save lives, and I think revoke the transgender use ban on hormones. I think it's ridiculous that I've been on I've been on hormones for I've been on hormones for well over 7 years now. Now, and I think, yeah, it's silly that I have to basically reproduce my paperwork from 7 years ago. Go to healthcare care professionals in order to be able to access it, but that's basically so yeah, so I'm hoping, so the test is going to be to see whether or not given the difficulty of finding bulk billing transgender GPs, PPs, the good news is if you go to Trans Hub, they can help you in finding transgender GPs in your state or territory, because Trans Hub have expanded the transgender friendly doctor list Australia wide. That is created by ACON, which is good. Great. So yes, you can get testosterone. You have to show ID, a little bit like going and buying alcohol. And you have to show your and when going and seeing medical professionals to get this administered, you have to show your testosterone agreement, uh, testosterone medical agreement, basically to access this. So yes, you can access it, but it's access it if you're over 18, but it's still got similar. It's got conditions attached to it where you have to produce your ID, and you have to produce your testosterone agreement. I was lucky when I found Dr. Rachel Burden, who put me on this originally. Hey, and now handled by, and then it was handled by Dr. Brad McKay. Okay, and yeah, like okay, and yeah, so I was basically able to walk into a chemist and get it, once I'd gone through the showing legal ID and the testosterone agreement. So that's all for now. Thank you very much. It was a bit longish, longer than what I really wanted to talk about on this subject. But my message to Tim Mickles: write the ban on transgender ban on uh, hormones for transgender youth under 18s. I think it's ridiculous that I think it's ridiculous that testosterone, a life-saving treatment, is basically treated like alcohol or cigarettes. It's cigarettes, like it's we're not talking like it's not an illegal substance in Australia. Like it's perfectly legal. It's prescribed by a doctor. It's a life-saving treatment for transgender people. Just like like somebody who is a diabetic who needs who needs insulin. Hormones is also something equally transgender people we need to save our lives. That's all for now. Bye.